This is Maritess.
Neil.
And this is Laura. Welcome to med-surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud med-surg nurses, just like you, sharing our stories, insights, and experiences to support you in your nursing journey. Our topic today is how to stay positive in a toxic work environment. But before we get started, we are pleased to welcome a new guest co-host to the show, Sam MacMillan. Sam is a nurse and a nursing education specialist. She'll be joining the panel for the next couple of episodes in the future from time to time. Sam, welcome to med-surg Moments.
Thanks, Neil. It's so great to be here. I'm so excited to be joining you guys for this podcast.
Why don't you get us started with our personal updates by telling our listeners a little more about yourself and your med-surg journey?
So I've been a nurse for 7 years now. I spent my first 4 years in practice in a busy ortho neurosurgical unit. And in the last 3 years, I've been in a nursing professional development role that I've really loved. I never really knew that I wanted to be in education, but I really loved educating patients. And I knew someday I would want to go back to school, and kind of the perfect opportunity showed up, and I've been here for the last 3 years and loved it. Last year, 2022, was a really big year for me. I finished my master's degree in nursing education, and I also got married. So 2022 was a really big year for me. I became an AMSN member about 3 years ago or so. And I also had a poster presentation at the 2022 annual convention in San Antonio. So that was really fun, really great opportunity. I've always loved the content and journals and podcasts and everything that AMSN puts out for their med-surg nurses. So really excited to be a part of this. I was seeking my own professional development opportunities, and I saw an email for this, and I'm really excited to be able to use this kind of as a platform and a place to talk to other people that I might not normally get to chat with about all things med-surg nursing.
That sounds like a great voyage here. Hoping to join the ranks soon of nurse educator myself. So it's great to have another educator on board and such a wild ride through the med-surg nursing world. Laura, any updates from you?
First of all, I want to say welcome, Sam. We're so excited to have you here. As for myself, things are going well. I am getting ready to leave on vacation, so it's been really hard to focus at work, but I'm keeping things together and things are moving right along. Maritess, anything going on with you?
That sounds very exciting, Laura. Sam, welcome. Very happy to hear that you are enjoying your journey with AMSN, and as well as being an educator. It is really fun to teach. So what's up with me? I'm also going for a vacation, Laura, and that's probably why I'm a little off. I'm in that mode, trying to plan. I mentioned in our previous podcast that we plan to go to Disney World. And so I shared that with the kids, and they're like, Mommy, let's change our plans. And so we have big plans. We're going out of the country. We're thinking of a place, but not quite sure yet exactly where. We have multiple places that we're trying to look at. So it has to fit the budget. It has to fit the time. I need to ask for time off. So it really depends on all those. So I'm on that mode of, where do I go? So I'm with you. We need to take care of ourselves and plan for that vacation. Neil, share with us what's going on.
School has officially started kicking my butt. I got about a week and a half left of my first class, which has been a great experience. Also in school for my nurse educator's master's. Other than that, that's been my big news. Just doing really well in class and trying to make it all work. Actually, and I just returned not too long ago from my mom's 75th birthday party up in New York City. So it was the first time I've been to New York in about 4 years since pre-pandemic, and I've seen her. I'm so grateful as a nurse. She takes one antihypertensive medicine at 75 years old, which is just like phenomenal to me. So it's good to see her with all her kids around her and most of her grandchildren and enjoy a special day. And she's a twin, so it's kind of double the fun.
That is very special, Neil.
Awesome. Yeah, we need to know her diet and lifestyle and all those. I need that.
You know what? I tell you, she was a smoker a long time ago. And in the 80s, if all of us are young enough to remember, the Great American Smoke Out. And she just, no nicotine patch, no Chantix, no nothing. She just put them down and stopped smoking. My mom, she ran around with us 3 kids her whole life. Eats pretty healthy. We're of Italian descent on that side. So I guess somewhat the Mediterranean diet. And she's actually gotten better about cutting out her carbs, eating her banana a day that the doctor tells her, and drinks water.
Is banana a new recommendation?
I tend to think it's part of the, takes cardism from what I know. So the sodium potassium channel pump the whole heart thing to kind of heart health, as opposed to the apple and antioxidants.
I'll have to remember that.
Why don't we move on to our topic? Today's topic is one I suggested: how to stay positive in a toxic work environment. I thought I'd start with a little background as to why I chose this topic. I'd recently moved to a different hospital system, and in the quick year, I've felt more appreciated and supported as a nurse than I've ever have in my previous place of employment, which I was at for 13 years. I've been nominated in the short time for a Daisy Award. I've been sent kudos, or cheers as we call them in our hospital there, multiple times from multiple level of peoples, whether it's management, CNAs, other nurses, and just recognized for leadership, which once again isn't necessarily a title, but how one carries himself on the floor. And in reflecting back, it's amazing how you can survive in certain atmospheres for so long and not realize how bad it is until you step out of it and really realize how detrimental it can be to your career. With my transition to Moses Cone Hospital, it's a breath of fresh air and field of nursing that they really hold their patients at the center of their care, let alone their nurses, which is why we got into it to take care of our patients. Sam, why don't we start with you, since it's your first episode as a guest and co-host? What are your thoughts?
It definitely sounds like you made the right move switching hospital systems. So I'm glad that you've been in a better place where you feel recognized, appreciated, and that's so important in any profession. But when I was looking at this topic, my initial first thought is, oh my gosh, you've got to get out of there. But not everyone really has that option. And some people might not even recognize that they are working in a toxic work environment. So something that I think is really important and that I remember and I share with people when they're maybe having a hard time is that we are all 100% responsible for the attitudes that we're bringing to our workplace. And we're also responsible for how we interact with others. Are we feeding into certain things, or are we giving feedback to our coworkers when maybe they're contributing to some toxic behaviors? And things like that. And I think it's just really important to try and be part of the solution. Are there things that we can work together on as a team with our leadership? Do we have shared governance structures, ways to celebrate each other? I think looking for those opportunities can be really impactful.
What you said at the beginning there was so correct. Sometimes you're in it and don't realize it, especially early in your nursing career. If you start out in a place that is toxic, but you've never been in a healthy one, it's so hard to realize, like, hey, this isn't really how this should work. And that's a hard cycle to break. And I think having been in a system for 13 years sometimes can really blind you to what can be out there. And like I said, it's not always easy to just say, hey, just quit and get another job. Transitioning sometimes, whether it's a bigger or a smaller city, just the opportunities become very limited, or so much you get lost in the shuffle of trying to get that job.
Sam, you sparked my thought about, how do you really know that you're in a toxic environment? How do you really know that you're working with people who are affecting you negatively? I say that because I'm thinking I've never probably been in a toxic environment. I've been blessed not to be in a toxic situation. Or perhaps just like what you said, I have learned to control my attitude, or have learned to manage my response with coworkers. I've seen toxic people, but good intentions, I always say probably that's how they are. I always embrace our differences. If they're reacting that way, there's a reason why they're doing that. It's not intentional, but you're correct. How do we really know that it's a toxic environment? Like if somebody talks loud and I laugh loud and people probably think that's crazy, I giggle and laugh a lot. But for someone who talks loud, or someone who has a tone that's always low tone, and someone that's always very authoritative, how do you really react to that? I always see it as, if there's someone who is making me feel down in an environment, in a working environment, I always look at the brighter side of things. I like when you said that you're looking for solutions all the time. And I think that's the key to that. Instead of adding into the problem, what can we do to make things better? Add value instead of complaining. I also learned how to ignore negative behaviors. I think that's really a skill that I'm so proud of. I
think one that you should definitely teach others to do. That's a hard lesson to learn.
I agree. It is hard because I've learned to just shrug it off, not in a bad way, but I try to make sure that I am pointing it into the right direction. Do I really need to react on it? If it's something that's going to harm my team, I definitely would say something. But if it's someone who just wanted to say something just because they wanted to say something, I try to just shrug it off. And if I need to talk to the person personally, I would do that. So how do we really know it's toxic?
It's hard to know sometimes. We've touched on this podcast before, is just always reminding ourselves to find the wins for ourselves, to find those little things about the job that make us happy and make us proud of what we do. It starts to bother me. And I can remember having, I won't say a toxic environment, but coworkers that I didn't always enjoy working with because we had differences. And I can learn to get along with people for the sake of the shift, but there were people that I liked working with more often than not. So if there were more people that I didn't like than I did like, it made going to work really, really difficult. As I'm walking in, I'm like, oh my gosh, I hope, so-and-so is not there today. When that started impacting my joy of being at work, then I realized that maybe I was not in the best situation. My supervisor would talk to me about, how are things going? Are things going well? If it got to the point where I felt I needed to say something, then that's when I knew maybe this isn't such a good place for me right now. So I had to find the courage to speak up to my supervisor about things that were bothering me. And there are supervisors that will listen to you, and there are supervisors that will brush you off. So when it came time to leave for another position, I knew I was going to a better place because I felt like my views were not being taken seriously. And when I made the jump and I realized what a supportive environment feels like, I had a better idea of what a toxic environment is. But it took a long time to realize it.
That's so hard to just not have it be around you. In Maritess, as a teacher, I used to ignore some inappropriate behaviors like that kid clicking his fingers on the table. Well, that's easy to ignore because it's just a small little habit. But when someone brings that negative energy, I do learn to just ignore that negativity.
Let me share a specific experience. I had a coworker previously, and this person, whenever we are in a meeting, whenever we had a problem that is being shared with the team, this person would always say, that will never work. How do you know that will work? I don't think that's a good idea. I think you're wrong. Everything that she says is so negative. And so as a leader, I can't react and say bad things, nasty things. No. So I always be the bigger person and say, how do you think we can handle this? What are your ideas? What are your thoughts? Maybe there's a better way. I can't see it that way. Maybe you see it in a different angle. And so she would start putting her ideas in, and now she's being empowered to be part of the solution. And I think that's really important as we receive those negative messages. It's not about us. That person is not pointing towards you and your personality, your idea, but it's just what the person is. And so eventually she probably got tired of me being too positive. And I always encourage other people, it's okay. She's just that kind of person. And they always tell me, Maritess, that's not right. I even brought it up to HR. There was a whole conversation, coaching that we had to do with her, because I think it's really important, to Laura's point, that as a leader, you don't just shrug it off. You have to listen to everyone. But also, as a leader, you need to give an opportunity to that person to improve. And so at the end of the day, she probably got tired and she's like, they're not giving up on me. They're staying positive. We stand as a very cohesive group, and she left. And I always believe that, because if it's part of your culture, and the outlier will always go somewhere.
I think if they're held accountable, and that's what you said about being a leader and recognizing when you have to speak up or when you have to make a judgment. When I was a manager, the one thing that I always try to remember is what you permit, you promote. So if you allow someone to continue to not be held accountable for their actions, it creates a feeling, a vibe on the unit, and your other staff know. And once you start losing good staff and you're holding on to this person, you're trying to drag them along, you're trying to build them up, you're trying to help them grow, and they're just unwilling to put in the work, and you start losing your good staff, you've got to say something. You've got to make consequences happen. And you've got to realize that if you don't do something about it, you're going to lose your team. You're going to lose good parts of your team. So it's important for managers to really pay attention when somebody brings something to your attention about your unit.
Yeah, definitely agree, because you got to listen to everybody. And the fact that if you're that person who can bring everybody, you're going to be the light. You're going to be the person who shares the direction of the team. And if that person is not willing to do what the team wants to do, they will find out what their next steps are. I didn't say that out loud, that this is our next step. But you probably thought like, okay, they're not giving up on me. They're staying positive and they're still finding solutions and they're still working hard. Where are they working hard? So just sharing.
That's exactly what you want. You want your team to function together as a group.
I think it's good for anybody, whether you're an educator or a manager or if you're on the front lines, but sometimes it can help to have some kind of key phrases that you've already practiced saying out loud to kind of approach or confront toxic negativity. If they're always talking badly about their other coworkers or they're always complaining about one thing or another, some people can have a lot of anxiety and like trying to approach them. So I think practicing saying those things out loud, like you're alone in your bedroom, staring at yourself in a mirror, whatever that is, but just saying like, hey, like I have some feedback for you that I think is important for you to know. Having those little tools in your toolkit can be really helpful and help you gain a little more confidence in trying to help combat these problems and either prevent your workplace from becoming a toxic place or trying to decrease the toxicity that you're working in.
In our units, I think every single facility that I've worked at has had unit-based councils or unit practice councils. These are the groups that try to do team building outings and try to foster relationships between coworkers and try to do fun things on the unit to keep morale up. Sometimes having some training with those people about recognizing those behaviors and learning how to deal with them, because everybody knows who the toxic person is on the unit. I don't think there's anybody that doesn't have an idea if there's somebody like that on your unit. It's just having the courage to say something. I think, Maritess, you said something earlier about getting to the root of it. Maybe that person doesn't share easily. We don't know what they have going on in their lives if nobody takes the time to get to know what else is going on and try to find out why they're acting the way that they're acting. But we want to try to get them actively engaged, at least participating in the team and doing a good job when they're at work, because your coworkers can make or break your job.
Laura, back to something you had said. I hadn't heard that in a while. If you permit it, you promote it. And it speaks very true of that one person that will get by with doing minimal work, just nag and bring that out. It is like a disease. It spreads. And all of a sudden, everyone just starts deciding they have to do the bare minimal to get by. And then there's 2 or 3 people that want to do everything, will push themselves and almost break themselves mentally and emotionally to get the job done. While there's that person just sit in the corner doing the minimal amount of charting and work and care for a patient. It's definitely detrimental, like I said, but if you permit it, you're saying this is okay.
Yeah, I actually forgot the term that we use, and I can't remember exactly the term, but if it becomes a norm, everybody would think that this is the right thing. And so if it constantly happens in the unit that everybody thinks that, oh, it's okay to bully someone, it's okay to gossip people, it's okay to talk about people negatively, then people would think that this is the norm in your environment.
I have one personal story that I'd like to share. As a new nurse, I was terrified of calling doctors. There was one doctor in particular that I never had good interactions with. He frequently berated me for calling him for things that he didn't think he needed to know about. It scared me as a young nurse, and he was honestly the first doctor that ever made me break down in tears. Like, make me feel like maybe I didn't need to be a nurse. This was probably my first year of nursing. I would have other nurses tell me that's just how he is. You don't need to worry about that. But I was really, really hurt. I hated taking care of that particular physician's patients. And whenever I had to call him, I would go to my charge nurse and I would say, here's the situation. I'll stand right by, but I would not call him. I remember talking to my manager at the time about it. There's a lot of things that happen that are out of your manager's control. And it took a couple of years, and I'm sure a lot more complaints before those complaints got to the CEO or the CMO desk before they actually did something about it. And they actually did end up getting rid of this physician. But it was years. It was years of nurses. And nurses all knew him. Nurses had nicknames for him. I think we all know how nurses talk. But when you'd get floated to other units, you could sense the fear. Nobody wanted to call this physician. I mean, unless it was an emergency, everybody would avoid talking to him. And to me, that was a toxic environment. And I don't think it should have taken as long for somebody to speak up and say, you need to respect your nurses. But I was glad that they finally did get rid of him.
You do have them still out there that will still just really not treat their nursing staff right. I forget about that level of toxicity, and they are hard to get because, I hate to say it in this way, but they make the money for the hospital. So
yeah, that's a good point that you make. I do feel like, because I've been a nurse for a long time, so I do feel like the culture has shifted. I feel like nurses do get a lot more respect now than they did at one point in my career. And I think nurses maybe are getting a little bit more empowered to speak up, and maybe there's more actions taken, but we can't let it stop. We have to speak up and we have to call out that behavior. And difficult as it may be, nothing's going to change if we don't speak up.
Oh my goodness. I love that. And I always tell that to every nurse. No one will know until you say something. Because if you don't say something, even your leaders, probably they heard this is happening, but to really have that number of people who really would validate, this is not right anymore. Some people are really afraid to say the situation, the difficult situation. But there are ways on how you can say that without really hurting the feelings of another person. Just be very objective. Just be very factual. That's so important. Thank you for bringing that up.
I feel like the Gen Z nurses coming in, they are not afraid to speak their mind. So it'll be interesting.
Excellent point.
What kind of shift we're going to see in the next few years as they continue to join the nursing profession and the workforce.
I agree with you. Gen Z is definitely a lot more verbal. I also, Gen Xer, I'm like, hey, I'm going to speak my piece because that's the kind of way we were raised. Also,
I'm a Gen Xer too, Neil, and I'll speak up now. But it was a few years ago, I was not opening my mouth. I just wanted to fade into the background and do a good job and stay under the radar. But as I've gotten older, I've gotten more vocal, and I'm proud of that.
And the old principal always told me, Neil, if you tell me you can't handle that classroom, you look incompetent. If you say it doesn't benefit the kids, I'm going to look at you more serious. And so you put the patient at the middle. I'm not calling you the patient's needs are XYZ for somebody like a doctor that might have that kind of attitude about why this nurse is bothering you. No, this nurse isn't bothering you. This nurse is trying to attend to your patient. So I've always kind of led with
great tool.
Yeah, the patient's needs, the patient's status has changed is why I'm contacting you.
If it becomes the norm, get ready for the storm.
I love that. That is so cool. That is true.
And we all know, especially down here in North Carolina, if you don't prepare for the hurricane, it could be very treacherous.
Circling back on our conversation a little bit ago about recognizing toxic work environments, I think it's really interesting how much connection there is across nurses across the country and the world with social media. I follow a number of different nurse-centric Instagram accounts, and you will just see hundreds and maybe even thousands of comments and conversations and polls, and they're gathering information and they're sharing things with each other. So I wonder if that might be a different opportunity for people to learn, like, oh my gosh, maybe I am working in a toxic place. I maybe didn't see it in that light before somebody else shared some information about it.
Absolutely. I think everybody needs to take ownership and become more self-aware. Because if you're in a toxic work environment and you're stressed when you're at work, it's going to bleed into your personal life. So that's a good point, Samantha. That's another great tool to dealing with those toxic work environments, is to pay attention to what's going on around you, to use those tools like social media to follow people that are living these same experiences and, find out what they're doing.
And I think the biggest question all the time when you come to work and you feel like you don't want to come to work and you hate your job, that's it. That's really a toxic environment right there. Like you don't want to do what you love to do. That's a red flag right there, saying that you don't like your coworkers, you don't like the work environment, you don't like the culture, and you're dragging yourself. You got to stop and think, maybe this is not really the right place, but also to think of what can I do? How can I improve the toxic environment? What are the things that I can bring to my leader? What are the things that I can put out there as a solution to this problem? Because you might be saving yourself from the toxic environment, but how about your coworkers who will be staying there if you leave? Well, believe it or not, we're just about out of time, but before we go, let's quickly summarize what we've learned.
Learn how to ignore negative behavior. Find a way to involve those creating problems in the solution to the problems. Find the courage to speak up to your supervisor if resolution cannot be achieved by other means. Have some key phrases prepared for the situations. Practice the phrases out loud. Seek to first understand, as we don't always know what's going on in the lives of others. Finally, always remember, if you let toxic behavior become the norm, get ready for the storm. Thanks for joining us. We'll see you next time.
We look forward to connecting with you on the next episode of med-surg Moments, the AMSN podcast. In the meantime, we want to hear from you. Send us your questions, topic ideas, and feedback via our official med-surg Moments email address, amsnpod@amsn.org. That's amsnpod@amsn.org.
Please be sure to leave us a review and recommend med-surg Moments wherever you get your podcasts to help us reach even more listeners.
The content within the med-surg Moments podcast represents the views, thoughts, and opinions of the co-hosts, may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Laura.
Neil.
And this is Maritess. And always remember, med-surg Moments is a moment in our lives, a moment in our med-surg careers that makes a huge difference.